injustices, talking about the horrible realities that people living with HIV and women face due to these horrible, horrible laws. Anyway, so that's what we're going to be talking about today. It's going to be in a very casual, cool kind of way. I am going to eat my yogurt to help ease the pain of such a, oh, hi. Perfect, perfect. Come. You can sit on stage with us if you want. Just because your outfit needs to go out to the world. It's being live streamed, so everyone can see it. Okay, so my name is Jessica Whitbread. I'm currently the interim global director for the International Community of Women Living with HIV. We are the only for and by global network of women living with HIV. We're kind of a big deal and we're kind of awesome. We're kind of the people you need to talk to and consult for all of your matters. Am I loud enough? I feel quiet. Okay, fine. Yeah. Turn me up. Anyway, so today during this session, we're going to be talking about criminalization of HIV, criminalization of key populations, and how this... Hi, Anne. Anne, you want to come talk about criminalization with us? Good time. And we are going to be talking about how this impacts women in our communities. So this is an issue that I care deeply about, and I am very, very excited to engage with everyone on this panel. So first of all, we're going to do a round of introductions. Oh, tag team. Who doesn't like a good tag team? So we're going to do a round of introductions so you can say your name and a little bit about what you're going to be talking about on this issue.
Hello, everybody. My name is Angela Moisenko. I am from Ukraine. I work in All Ukrainian Network People Living with HIV, and our organization provided care and support for HIV people.
Hello, my name is Lena. I'm from Ukraine. I'm working in Eastern Europe and Central Asia with support women living with HIV in All Ukrainian Network, and we will talking about criminalization and our support and prevention women's in the prison.
Cool. My name's Sarah Feagan. I'm a Positive Women for Victoria, and I'll just be bringing an Australian perspective on criminalisation and justice and what it means to be a positive woman and facing these issues.
Hi everyone, my name is Rani Ravundi and I'm from the Fiji Islands. I'm the coordinator of Survival Advocacy Network, Fiji's national sex worker body, and I'm a transgender sex worker.
My name is Morolake Odetoyinbo. I'm from Nigeria, and I'll be talking about the new law that was passed, the anti-same-sex bill. What effect does that have on HIV, and what effect does it have on women, and what are the laws we have that affect us as women with HIV in terms of motherhood, adoption, and things that you cannot access because you are a woman living with HIV.
Shame.
Shame.
So, okay, this is going to be a very lively discussion. I cannot wait. If you are just walking by and not stopping, you are going to miss out. Truth be told. Okay, so first let's talk about some of the oppressive laws that have been happening around the world in regards to gender and sexuality. Sorry to interrupt your yogurt time.
That's fine. Say?
You can use this microphone.
Oh, okay.
Pull it out. Like you're a rock star,
So, once upon a time in Nigeria, we had, and we still do have the sodomy law, but looking at it, it's the way it's written, it's talking about men who have sex with men. So the law only affected men, and we thought it was okay because somehow, for the very first time, as women, it didn't affect us. So if you were lesbian, then it really is not about you because it's not about sodomy. Then they woke up and decided, actually, we need to have a law that bans same-sex marriage, and this time they lumped everybody in together. The big problem with this law is that not only is it talking about you not being able to get married, but it's also talking about it is now an offense if you do not report and you know that there are people in same-sex relationships.
So if you are an ally and you're a friend to someone who is in a same-sex relationship or is pushing back against heterosexual norms, you can be charged too?
Yes, because then you will be aiding and abetting. So no, you're not the person who really is. Yes, it's you are part of this whole thing. Even so, that's one of the problems we're having. And the problem, the challenge for the HIV activists is, what effect will this have on treatment? What effect will this have on people being able to access care? And what then does it do if there are people in the population who will go underground, who can no longer come out because you have a law that criminalizes their very existence? So your existence has become, you are now an illegality. I think that's the best way to put it. We also have laws. There is no law in Nigeria against prostitution. We do not have that in the constitution. But the Federal Capital Territory recently passed an anti-prostitution bill or law in the Federal Capital Territory. So that's the only part of the country apart from the states where you have the Sharia law. And in Nigeria, the states have a right to pass their own law. So some states will use the Sharia law, which is Islamic law. In that case, you will be arrested for prostitution. But in other parts of Nigeria, the only thing they will arrest you for is what you call loitering. So you will be arrested for loitering, you will be arrested for meandering, but not for prostitution. But the Federal Capital Territory has passed an anti-prostitution law, and now sex workers are being picked up and arrested.
Wow, that is a total shame, and I think that we need to definitely push back against such oppressive laws. But it's also a good segue into talking to our sex worker expert on these laws. And so yeah, tell us what's happening in Fiji and more broadly, perhaps in the Asian Pacific region and globally around sex worker criminalization.
Back home, the laws around HIV and AIDS have been progressive to some extent. In 2012, there was the introduction of the HIV decree, where people living with HIV are well protected, and sex workers cannot be charged with carrying condoms as evidence. But in regards to sex work, it's still decriminalized, all aspects of sex work, our clients and the sex workers, and even if you're working from home. So it's still all criminalized. And I feel that criminalization of sex work, people living with HIV, MSM, homosexuality, it is driving the HIV epidemic. It fuels stigma and discrimination. With stigma and discrimination, it makes people feeling very uncomfortable to access services that are available. For me, decriminalization is the way forward. It's the only way where we can decrease or end the HIV epidemic.
All right. So it's encouraging that some laws in Fiji have been shifting, but we well know that in some countries they're shifting for the better and others for the worst.
In terms of sexual orientation and gender identity, February this year, our constitution came out, and it's in the clause against on anti-discrimination. It's got sexual orientation and gender identity mentioned in it. But I still feel that there's an unbalance, because most of us same-sex couples want to get married. So they are giving us the freedom to be ourselves, but then they do not give us the freedom to be bonded together in a civil union.
Yeah, I think there's also often a lot of hypocrisy that exists between what exists in policies and what actually happens on the ground. Like, so there can be stuff around anti-discrimination, but we all well know that on the ground, the reality is a little bit different, or a lot different. Thank you. Now we'd like to go and talk about, what about people who use drugs and the laws that criminalize and govern their bodies?
Yeah, we want to explain our situation and discussing about our situation in Eastern Europe, Central Asia region, and we want to show you some cases from Ukraine about criminalization and situation of women who using drugs in Ukraine. First case is about women who is drug users. And she said about her case, I use drugs and provide sex services at the highway Kharkiv-Simferopol. I was walking. Police car drove up to me. 3 persons in uniform ordered me to get into the car. They started blackmailing me and demanding money. I refused because I didn't have money. They took me to the forest and raped me and left me there. I hardly managed to get to the highway and then home. I did not search for any help. I was ashamed.
It's a powerful story.
Most countries of Eastern Europe, Central Asia region have criminal liability for HIV transmission. Such laws impose regimes of surveillance and punishment on sexually active people living with HIV. There is no evidence that laws regulation the sexual conduct of people living with HIV change behavior in positive way. Such laws are often arbitrarily and disproportionately applied to marginalized groups and those who are already considered criminal. And I have one case from Angela. She's working in Chernigov region in Ukraine, and she's working with women's in women's prison. This prison is only for women who are not have crime at first. It's second or third ones, and almost most of cases of this crime is from drug users. And women who are at the prison have some problems, and Angela wants to show these cases and speaking about this.
Hello, I will be speak Russian because my English is not enough for this presentation. В Черниговской колонии отбывают наказание 600 человек. Из них 250 живут с ВИЧ.
In this Chernigiv prison, now there are 600 women. 250 is with HIV. They are living with HIV.
В колонии есть дом матери и ребенка, где женщины пребывают вместе с детьми.
In this prison, women are be with with the kids. We have a daily center for kids, and they can be there together.
И основная проблема этих женщин – отсутствие доступа к диагностике и своевременному лечению.
There are no access to treatment, diagnostic and treatment, not only ARV drugs. They don't have access to any health care in this prison.
Так связано потому, что система пенитенциарная не входит в систему охраны здоровья государства.
We have separated healthcare and penitentiary system, and Ministry of Health is a separate system.
отдельный бюджет, и в пенитенциарной системе выделяется намного меньше денег для заботы о здоровье.
And they have a separated budget, and Ministry of Health has some money, not more, but it has some money and support. And penitentiary system are not money, nothing to support women with health care. Only for food, it is not enough, and women need to work and to earn money to their food, to have food for this place.
Благодаря нашим проектам по профилактике и уходу поддержки улучшился доступ к услугам по профилактике туберкулеза и по лечению, АРВ-лечению.
Angela's organization applied for different donors, and they received a project from Sedaction and Global Fund, and they provided services for these women on prevention, counseling, support, testing, and provided diagnostic for these women.
И на сегодняшний день 60% из тех, кто нуждаются в лечении, получают.
Now it is possible for 60% of women who are at this prison because Angela's team help them.
Проводится лечение, проводится тестирование, консультирование и уход и поддержка.
They provided this, but we try to do advocacy that penitentiary system to get money for these women, because the Global Fund will gone, and we need to create the system and to apply into different services in our country, and we need support of our government. It's all. Thank you.
Thank you for that. I think that we often forget about the women who are incarcerated. They are often not part of the discussion, and I really value that being brought to the table. Before we just move on, I don't know if you know this, but Olena and her organization were the recipients this year of the Red Ribbon Award. Hello! Which is absolutely fabulous. Anyway, I thought just because this is on live stream and we were not all at the ceremony, that's right. Wave to the camera. We have a real live celebrity in the house on the Daily Dialogue. So we've talked about criminalization of people who use drugs, people who are sex workers, people who are in same-sex relationships, gender. We talked about that stuff. Now let's talk about how all those things get compounded when you're a person living with HIV. It is a dark, dark time in that regards. And, if you're a sex worker and you're living with HIV, your charge can be compounded, often aggravated, just because you are a person living with HIV. Similarly to someone who uses drugs. If you're a person living with HIV, a woman living with HIV, if you don't disclose in many countries, you will be considered a criminal, actually charged with anything from aggravated sexual assault, which is rape for not disclosing. And in some cases, it goes to manslaughter or a type of murder. And I think this is highly problematic because in many of these cases, there is no transmission. And they say exposure, but we need to be very careful about using that language, because if it's less than or approaching zero in many cases, if people are on treatment, how are you even being exposed? What are you being exposed to? Or if a condom is used, you're not actually being exposed to anything. So And other ways that women are criminalized, or could be, this law could be, is around vertical transmission. I'm sure some people in the audience might want to talk about how breastfeeding is criminal in many countries and cases. Women have their babies taken away from them, and so on. So I am now going to open it up to hear about an Australian perspective around some of the criminalization and non-disclosure laws here.
Well, just as you mentioned about the way that people are charged, under sex offences, which in Australia, most people are charged under grievous bodily harm. But that differs from state to state. So some states, if you do not disclose your status before having sex, it is a criminal offence and you will be charged under the Grievous Bodily Harm Act, which is archaic, it's outdated, and it's time for that to change. People that have syphilis, chlamydia, gonorrhea, they're all STIs that can kill you. They are running out of treatments for gonorrhea. That is highly more infectious than HIV, yet we are still the only ones that are criminalised for having this STI. Those that are born with it are born as criminals. And these are archaic laws. I even saw on the Scarlet Alliance website last night that 3 years ago they were recommending to criminalise sex workers' clients. It just shows how unprogressive our governments are here in Australia, and just the need and the push. I mean, as a young person, everyone has sex. We all want to have sex, but it's really hard to try and engage and enjoy sexual activity with this law and this thing of being a criminal hanging over your head. I thought I was quite versed in criminalisation and justice laws before I came to this conference, and I've learnt so much more. So I really want to hand it back over to the panel. I just wanted to make that point that, I guess we all feel the same. We're all in this together. We're not criminals, and it's time for something to change. So,
no, thank you for that. Yeah. I don't know. I think one of the things you said around, there's so much you didn't know, that's one of the problems is, we live in a global world. For instance, if you come to Canada, and the laws are much different than in the Netherlands. So in the Netherlands, you don't, there's different laws around disclosure, definitely not as harsh as in Canada. In Canada, you have to have an undetectable viral load and wear a condom. They mostly talk about penetrative sex, that's where it's at right now, but so it's you need to know that you're undetectable. As we've learned in this conference, many people don't know their viral load because they don't have access to viral load testing. It's very expensive. The second thing is that, if you think you're from the Netherlands, my friend, he's like, you don't need to disclose. I was like, what? I need to disclose or I'm going to go to jail.
I'm moving there.
It's yeah, I know. It seems dreamy. No, they have their own problems though, but as we all do. But yeah, you might not know the laws and you might not know how harsh they are in a different country, because absolutely it's ridiculous that you would need to have such a high standard and still could be considered a risk. High standard, that sounds weird. But so I want to open it up to the floor, or if any of the panelists have any more comments to add, because I actually think that, yeah, all the stuff that I've heard, I think it's quite a scary time. And how can you criminalize clients of sex workers? How are you supposed to make money if you have no clients?
It's archaic, backward thinking governments and lawmakers.
We live in a modern age and time has changed, and we need to move with that change. We have to adapt ourselves and our mindset to the change. As long as we are not harming anyone, that's where states, agencies, stakeholders should work with communities. Don't just see us, you should hear us. Hear what we're saying, and together we can take action and address these issues.
Woo. I think, well, maybe this might not be criminalization, but this is definitely injustice. In Nigeria, for example, a woman with HIV cannot adopt a baby. because you need to have a clean bill of health for you to be eligible for adoption. So if you do have HIV, then you cannot go adopt a child because you are, I don't know if you're a health risk to that child. At some point, I was saying, okay, can I get a baby who is HIV positive? But even with that, said no, the law is that you need a clean bill of health for you to be eligible for adoption. It's the same thing if you're a single woman, you cannot get sperm from the sperm bank. And some hospitals, some clinics will say, yes, you can, but a lot of the clinics won't. As a single woman, you would have a hard time getting one. As a single woman with HIV, you might as well just go back to your house and go, you know. And that's one of the things I think might not be outright criminalization, but it's definitely an injustice. When the Nigerian bill was being drafted, the anti-HIV stigma bill, we were all excited because, you know, the way it was pitched and the way women saw it is finally the men who are infecting women without disclosing would finally go to jail. Woo! What we didn't realize is it ended up saying if you knowingly expose someone to HIV, then you are liable. So knowingly exposing someone would mean I know my HIV status, I chose to have a baby, I did not go for antenatal, then I knowingly expose that baby to HIV. And it would also mean that if I know my status and I knowingly I have sex with someone, then I am in trouble. In a situation where men don't even get tested, whoever gets to know first is the one who is responsible. Women are the ones getting tested because they are the ones in antenatal clinics, so they are the pregnant ones. So a pregnant woman will get tested, she knows her HIV status, but she doesn't even know how to disclose to her husband because she's afraid of the violence. If at some point he can actually then take her to court to say, you knowingly exposed me to HIV. Because at no point did he get tested to know where did HIV come from in the first place.
So that is an excellent point. A lot of these laws around criminalization of HIV exposure and transmission were originally created to protect women from contracting HIV. You know, and I think my question to the panel is, do you think that these criminalization laws actually protect women?
If women are the ones forced to get tested, if women are the ones, it's the women and the children who are getting tested. So if you've got a sick baby and you are the one taking your baby to the hospital, the baby tests HIV positive, you will end up getting tested. If you're pregnant, you will end up getting tested. Women, the health-seeking behavior for men, a man must be dead or dying to go to the hospital. For him to go to the hospital, then there's somebody, he really can't help himself. Somebody has to take him there. So it's the women who are the ones seeking health care. They're the ones testing for HIV. So they are the ones knowing their HIV status, which means now that you know, you bear the burden. And so it's not protecting women.
It's like whoever finds out first, it's their fault.
Yes. Exactly.
All right, Olena.
Yeah, we have the same situation in Ukraine and in Eastern Europe, Central Asia region too, about if not only you HIV positive single woman, if you are HIV positive parents, you are not can adopt children from orphanages. It's very so for us it's the most problem situation because many HIV positive parents want to be parents and take a child from orphanages, and we have a very horrible situation in our orphanages because child in these places are violence and very horrible place for kids. And we have a same situation about fraternity services for HIV positive women. They are not they don't make echo. I don't know how in English is it if. Yeah. If mother cannot be a mother and pregnant, they go to surrogate. We
Surrogate
couldn't.
parent.
we couldn't do it in our country too. I think it's the first and the main problem which we have in our countries.
I guess I'd like to add, it's a little bit off that topic, but I guess the same, just issues about criminalisation and people not acting up. And this is a personal story, and I know I met the victim of this. There are 3 men still at large in Melbourne that lure young men into their homes, tie them to a bed, rape them. 3 men that are all positive, and to spread the disease on. They're sociopathic people, and there are many victims of these guys. I've met one of them, and he knows of several other people as well that have fallen victim to these people. But yeah, they are all too fearful to stand up and actually take action against them. They see them still around, the areas that they live in the city, but the people are just too scared to stand up and fight back and own their criminal rights. And this, I guess, as well then goes, do we criminalise them because they're infecting people with HIV, or is it, I feel it should be based on the fact that they're raping these boys. Just from a really local, this is Melbourne now perspective, and these are the issues I guess we have.
Well, I think this talks to some of the complexities around criminalization, and I would personally perhaps argue that that's not around. Rape is rape, with or without HIV. It is rape, So that's one issue, and the second one is. Sometimes people who purposely or maliciously try to pass on HIV, maybe we need to start looking at it from a mental health lens. It's maybe not I don't know, this is controversial, but it might not be a criminal offense, but maybe it's something that we should approach in a different way. Maybe people need it. Disclosure is very, very, very hard. It is, I can look at everyone probably, and whatever we have to disclose, like if you're living with HIV, you totally know it. If you are someone, you have your own thing to disclose, whether you, have you're a survivor of trauma yourself, whether you have, you're transgender, whether you are, have your mental health stuff. It's not fun disclosing. It's not fun to have that conversation. It's actually extremely difficult. It puts you at risk for violence. It puts you at risk for, systemic violences that people might tell other people in the community. You could lose your jobs, rejection. Yeah, we can't I know one of my old bosses says this isn't about feelings. I'm like, this whole movement is about feelings. Just because I'm a queer woman and like to process doesn't mean you don't all too, This is about feelings, and this is about real people's lives, and disclosure is hard, and sometimes we come at this and we do things that are messed up, and we do things that are not always nice to the people that we have sex with or our lovers, because we're scared, because we're broken, because we're hurt, and we don't have necessarily the tools.
But we are not criminals. Exactly.
So I know we're not criminals, and that's what we have to have conversations about, creating stronger systems of support for people to work out all the things that they need to. Did you have something? Go. Yeah. Go. I'm blabbing.
Хочу подтвердить эти слова. Через нашу организацию проходит около 1000 человек за 6 месяцев.
Angela's organization provides support for 1,000 people per 6 months.
И 70% людей сообщают о том, что им нужна поддержка именно в процессе раскрытия статуса.
And 70% of these HIV positive people talking about they need psychological support about HIV disclosure.
В первую очередь для того, чтобы раскрыть свой статус близким.
First of all, they need support to talk about with relatives.
И они боятся того, что отношение к ним изменится.
And they're afraid about the relatives change attitude to these people who disclose for them HIV positive status.
Но в первую очередь это связано с самодискриминацией.
And self-stigma. We have a big, huge self-stigma of people living with HIV.
И также работники организации нуждаются в специальном обучении относительно поддержки людей в раскрытии статуса.
And we need new knowledges and trainings about self-stigma, about support people who ready to or not ready to disclosure HIV positive status. It's a main problem which we have.
Раскрытие статуса у детей, поддержка семей проводилась все время, а вот со взрослыми мы только в большей степени начинаем работать.
We have such programs for disclosure HIV status for HIV positive kids and teenager, but we don't have knowledges and trainings about disclosure for HIV adults.
Thank you.
I think when you talk about disclosure, some of the work we're doing right now, we're working with adolescents. And the questions the kids are asking is, at what point do I disclose my status? So you're talking about children who were born with HIV. Now they're young, they're teenagers. And at what point do I tell him? Is it when he says, I like you? Or is it when he says, I want to have sex with you? Or is it when he says, I want to marry you? At what point do you disclose your status? And for the kids, it's not just about the boy rejecting you. It's about him turning around and telling everybody in school that you are HIV positive. And once that happens, then what does that do to this child when all of a sudden the entire school knows that you are HIV positive because you told one boy and you were trying to do the right thing? Yeah. And that's really the challenge. How do we support people to disclose? When a woman goes to antenatal and she's told she's pregnant and she's told she's HIV positive, how much time is enough time before she can disclose to her husband? Because she knows that if she discloses, there is economic violence, there is physical violence. She might lose her home, she might lose her children, she might lose her source of livelihood. So how much time is enough time? And how do people disclose, and what support do we have for women? Rather than say you are the criminals, you want to infect other people, how do we support our girls and our women to disclose in a safe way?
And in many cases, that's a good point. In many cases, it's actually safer not to disclose. Disclosure can put you at risk of more. Do you want to make a point? Yeah, come. But disclosing your HIV status can put you at risk for more violence. So why would you disclose? And it's unfortunate.
Please join this conversation.
Yeah,
Ask us
come.
questions.
Yeah, we're going to open it to questions and comments too, because exposure, yeah, so why would you if you're just going to be
Beaten up.
yeah, beaten up or something?
Well, first of all, my name is Joavin, and I'm from Fiji, but now I'm living here in Melbourne. For someone,
You got to talk quiet in.
sorry, I'm 31 years old, and I was infected with HIV when I was 20, in my early 20s. For someone,
You got to talk into it like you're eating it.
I mean, the topic this morning is very interesting, and for someone who's living with HIV to go out and disclose their status to the public or to her family, it takes courage. You know, as for me, it took me like 8 years for me to disclose my HIV status to the public, and for me, it's not an easy thing to do. And you know, when you're living with HIV and to go out and disclose your status to the public or to your family members, like for me, I don't have any more, you know, private life unless you're at your own place, you're inside your home. But when you go out there into the public, people know that this is who you are. You're a HIV positive person. I was diagnosed through I was approaching the 8th month of my pregnancy when I was diagnosed with HIV, and I didn't know that I was infected with virus. And you don't have to go around and sleep with men, or you don't have to sleep or have sex with a couple of men to get HIV. It can be your first sexual partner, you still can get it. But with a disclosure, before I used to work with the Pacific Island AIDS Foundation when I was back home in Fiji, and one of the things that we did is we training positive people to provide them to. We did it is called an AIDS ambassadors training to train them to become public once they were ready. Like when people are ready to go out public about their HIV status. But for me, it took me 8 years for me to go out and tell the public this is who I am. But I for the time being right now, I can say I never regret my life as a person living with HIV. And now I've been given another chance to have another family and another son. I brought my son here yesterday. So, yeah, it was
so cute. Oh my God.
Thank you. So, yeah, disclosure, it takes courage. You don't have to disclose the status, but when you are ready, you can. Yeah.
Yeah, great. All right, questions. But I just need to bring up one little thing or else I'm going to be killed by Lillian. Have you heard of the Rosemary Namubiru case?
Yes, the health worker.
So she is, and I think this is really important, she was supposed to be on this panel, so I'm just going to quickly bring it up. There's fact sheets. Oh yeah, we need to talk about breastfeeding. Rebecca will bring that up. And Rosemary Namubiru was a healthcare worker, 64-year-old woman in Uganda who accidentally pricked herself when she was going to do an intravenous to a young child. She went, she cleaned her hand, she came back, and there is some discrepancy on which of the needles she used. She made an accident. What ended up happening to this poor woman who had been in the industry, in the healthcare provider for decades, is she was paraded around in the media, called a baby killer, a monster, and just totally, her life is ruined. Now they blew off an old law that has actually never been used in Uganda, and she got 7 years in prison, I believe, which is an absolute shame. And I think that we need to really consider this is not a one-off, and this will continue. So, Rebecca, you want to come talk about breastfeeding? Because, as you all know, lots of us are having babies, and breastfeeding is a serious issue.
Thank you, Jessica, and thanks, everyone. This is really an issue close to all of our hearts. I'm a woman living with HIV for nearly 20 years. I'm Melbourne-based. And women in Australia are not really given the space to talk about breastfeeding, or the fact that we are not allowed in Australia to breastfeed our babies. In fact, some women have been threatened through a criminal process if they talk about wanting to breastfeed. Through our national networks, we've written position statements that went to lawyers, and they told us we can't produce these position statements. So I think what this panel and women globally are calling for is a space for women to share our experiences, but more than that, to really talk about breastfeeding and the impact that has on us as women if we're not allowed to breastfeed. And we need to create those safe spaces so that then we can talk to policymakers about the North and South experience. My peers have come to this conference and they've told me, oh, we have to breastfeed, we're told to breastfeed. I tell them I'm not allowed to breastfeed. You know, there's conflicting messages for women, but at the end of the day, it's the emotional and social impacts on us around not being able to breastfeed. So thank you for the space.
I think it's interesting because, you know, the same argument we are given for us to breastfeed is unfortunately what has been turned around, and in this case, so we are told do breastfeed if you have if you have access to medication and you've got a non-detectable viral load. So breastfeed, because if you do not breastfeed, your child would have diarrhea. You don't have access to clean water. Here you have access to clean water. You've got access to medication. You have a non-detectable viral load, but if you breastfeed, is an offense. When you look at the standards, so what's the universal standard? Where are the standards? And it looks like the laws or whatever it says are biases is really about women living with HIV, nothing scientific. You know, because if you are thinking of a science, then I think, if anything, the women in Australia who have clean drinking water, who have non-detectable viral load, who have all of that, should be the one who should be allowed to breastfeed, on the other hand.
All right. So anyone in the audience have questions? Questions?
We won't be
Andrew?
offended. Please ask.
Yeah, I've just got a question about the fact that positive women cannot adopt positive children in
Any child.
Well,
You can't adopt any child.
Well, any child, but particularly with the positive children. How many positive children would be in orphanages, say in Nigeria and in Ukraine? Is it a lot? Is it a massive amount of children?
Yeah, and that's the big problem. As a person with HIV, you are not allowed to adopt for health reasons because you do not have a clean bill of health. I personally said, okay, give me a positive baby. And I was told it's not about the baby being positive or negative, it's about me being positive. Unfortunately, nobody wants to adopt the positive baby either. So you've got babies living with HIV. Nobody wants to adopt the positive babies because everybody is looking for a healthy baby when you are looking to adopt. We are not allowed to adopt because we've got HIV. So it's both ends, whether you are a parent, an intending parent with HIV or a child with HIV, you've got nowhere to go. Recently, we just stacking up something called Mary's Home. It's a home for adolescent girls with HIV. When young people have nowhere to go because they've lost their parent, nobody wants to adopt a teenager. You are trying to get rid of your own teenager. You don't want another one in your home. Now, when it's a teenager with HIV, it's doubly difficult. Even young children, toddlers who are 3, 4, people don't want to adopt older children. Everybody wants the infants. Young people who have no place to go, have no one either to adopt them or even to foster them. But those of us who are living with HIV by law cannot take them because we do not have a clean bill of health.
We have 5,000 HIV positive kids in Ukraine, and 500 are in the orphanages. 5 years ago, nobody wants to get these kids from orphanages because they are HIV positive. But we start to provide different programs, and now we have some achievements because people start to bring these kids from orphanages. HIV positive people are at the family, and when parents died from AIDS, these kids take their relatives, mother or father from this person who died. And we have a very good case when Odetoyinbo's father, pastor, take 40 children in like home, foster family home, and he takes 40 kids HIV positive from orphanages. And in different regions we have different situation, different amount and numbers of HIV positive people and kids also. And now we provided this information about these kids are same of HIV negative, and we need to take them from orphanages. And we are working in our country about we need cancelled orphanages. We need to do foster families. We need to develop this. We need to cancel orphanages in any countries.
Thank you, thank you. So are there some more questions from, oh, we got some.
No, mine is not a question, but just to let you know that in Namibia we had the first sterilization case, and when we met with all the women whose cases were proscribed, one of their requests was saying that we wish the government could allow us to adopt so that at least we can be called mothers and we want to have children. But there are barriers, and in Namibia we've got a challenge with the OVCs. But still there are barriers because they are living with HIV, and the mothers are saying, you sterilized us, please give us the opportunity to adopt.
And I think that really is most unfair. A woman with HIV has been sterilized just because she has HIV without her consent. Now she's saying, it's bad enough you've sterilized me. Can I then adopt? And you say, I still cannot adopt because I have HIV. If that is not, I don't know what else to call that if it's
That's
not about
criminal.
heartless. Yeah. And totally heartless too.
And the forced and coerced sterilization of HIV is happening not only in Namibia, but it's actually happening in every single region. And we have, ICW has documented cases in many of your countries that deny that this is even happening. So a lot of people are actually scared to even, or fail to acknowledge that this is happening to women, and it's happening quite a lot.
Yeah, and either they're sterilized or they're forced to have an abortion. Because then they'll tell you, no, the best thing is just get rid of the pregnancy because your child would have AIDS. So it's either they are sterilized or the women are forced or coerced into having abortions. And they're told, for your own health and for the health of this child, just let it go.
Okay, depressing. Anyone else have questions? I know you're mourning that. It's a hard topic.
Well, how about on a happier note, in Australia, in the last 2 years, there have been no babies born with HIV. So that's something to celebrate, and hopefully the rest of the world can enjoy that one day too.
And I hope that as she says that, I have to cover my face in shame because I come from Nigeria, where 30% of the world's HIV babies are produced. I come from a country where we produce 30% of the world's infected babies. And that's because our women do not attend antenatal care, because health-seeking behavior is poor. And when the government is talking about antenatal care and PMTCT, I hate that word PMTCT, but when they're talking about it, they're not looking for the women where they're having their babies. Women are having their babies with traditional birth attendants, in mission homes, at home, but you're waiting and telling them to come to the health center to access services. They have never gone there. Why should they begin to go there now? If we really are serious about preventing new infections, we should meet the women wherever they are. And we need to have a law that says free antenatal care for every woman, not just HIV. If this is free, then women will be encouraged to come in there when they know that the services are free and if they are treated as human beings.
I do agree with you. In Zimbabwe, when there was payment for registration for ANC, women were not coming to the clinics. But when we started having community mobilization, going to the communities, explaining to the mothers that they could come to the clinic and have free services, then the numbers increased so much. And I'm still saying, though we say it's prevention of mother-to-child transmission, it's not mother-to-child, it's parent-to-child transmission, because both parents are in it. And the only way we can win is to go to the communities, get to sit down with the people who are involved, get to the community leaders, get the community leaders convinced that it is a good thing for them, for the mothers to deliver at the clinic. And if they don't deliver at the clinic, they still have a window period where they can come back with the baby immediately after delivery. Because sometimes it's not that mothers don't want to come to the clinic. Some mothers live something like 30, 40 kilometers away from the clinic where I come from. And if it's at night, they can't travel to the clinic to come and have a delivery. And sometimes they can't get transport to get to the clinic. So we still have to go and explain that there is still a window period of 72 hours after the birth of the child where they can still do something about it, even if they've missed the period where the baby was born. So it is up to us women to go and do community mobilization. And I'm talking about not just community mobilization where you're getting salaries from an NGO. I'm talking about voluntary work where we as women take it as our challenge to say, even if we're working for nothing, and if it's not working for nothing, it's not always working about money. It's working because I want to see the next baby born HIV-free, and I want to create an HIV-free generation. That's what we should work for. And if we work in one area and not in the other area, these children that have been saved from HIV are still going to meet with those that were not saved from HIV, and we cannot win the war. The only way to win the war is if everybody, everywhere, every place, every corner, there is no child who is born with HIV. Thank you.
Thank you very much. But let me add something to what you said. I think as women with HIV, we have bear the brunt of this epidemic. We are the volunteers in the clinic. We are the ones who work without pay. We are the ones whom society has decided that because you have HIV, it is your responsibility then to teach and to train and to do all of that. So women have worked as volunteers. They have been counselors. They have been trained. And they have done great jobs. As soon as those jobs they have been doing suddenly get some funding to say, now we are going to pay counselors, you know what happens? Our women are thrown out because they don't have the paper qualification. They have done that work and they have done it very well. But suddenly you need to have your school certificate and you need to have your matric or whatever it is to qualify to be a government worker. Which means that women with HIV continue to be volunteers. Our children cannot feed on volunteerism. Our children cannot go to school on volunteerism. Women with HIV need to get paid for the work they do. We are tired of being volunteers. That's our entire existence. And would like to take this message across to say, pay women for the work they do, with or without HIV. Women in general, that's what our entire life is about, volunteerism. In our families, in our homes, we never get paid or appreciated for what we do. And we really would like to turn that tide. But I do agree with you. It's everybody's responsibility to say, let's end new infections in babies. And like you, I hate that word PMTCT. I hope that those listening, if you don't take anything back home, please tell everybody we do not want PMTCT. It's not mother-to-child transmission. It's parents-to-child transmission. We're tired of being the ones held responsible when the child is infected. Thank you.
Okay, great. That is excellent for your closing argument. We're just going to do one quick line from each of us. Final line.
I would just like to stress on what I said before about, we are now living in modern age, and we need to adapt ourselves and our mindset to the changes that we are going through. States and agencies should listen to communities affected by HIV and living with HIV. Listen to us and we would work together, and that's the only way forward.
Thank you. Okay.
I think we just need to remember that HIV is not a crime. We will fight for our human rights.
I think together we can.
I believe we will win.
Yeah! This is like one of those nice stories where everyone says a line. So I wanted to thank you for being here in the Women's Networking Zone at the Daily Dialogue hosted by ICW. We are here every day from 11 till 12 talking about issues that matter most to women living with HIV. I also want to do a little plug. ICW is it's the International Community of Women Living with HIV. We're the only global network for and by positive women, which makes us very, very special and very beautiful. Look at all the ICW babes that we have. If you want to have your portrait taken, if you're any self-identifying woman living with HIV, you can be an ICW member. Or a model. You can be a model here today. Or tomorrow, because Vicky's out of the house. But so tomorrow, we're having a very important meeting. ICW will have a general membership meeting, which is only for women living with HIV. Once again, all self-identified women. And we're going to be meeting here at 11 o'clock a.m. We encourage you to join. If you're not a member of ICW yet, come talk to us after. And this is very easily done.
Just really quickly, at 1:45, I believe it is today, we're having a dance party here for the access to female condoms. And a dance party tonight, no pants, no problem party. So if you need to have a break, you need to want to shake your ass, have some fun, come down here.
Join us at 4 o'clock right here. 4 o'clock right here in the Women's Networking Zone. We will be talking about writing our stories as women. What is it that you want to get out? How do you write your story? My colleague Kara and I will be here, and it's hands-on. We really would like you to come at 4 to 5. Let's do writing.
And I just wanted to add, we've got an extra addition to the program happening right now. which is with the YWCA. It's creating a safe space for young women to live with HIV